Hi everyone, Lee Pacchia with Mimesis Law here. We're talking with Lisa Noller. She's a partner at Foley Partner today, and we're doing a deep dive into healthcare fraud prosecutions. Welcome, thanks for joining us.
Of course, thank you for having me.
So let's start with the basics here. Can you give us a little bit of a background on how these types of cases have been prosecuted historically in the United States?
Sure. Historically, the case has actually relied on somebody coming forward. So a witness who worked for an entity, a pharmaceutical company, a hospital, a physician's group, or a patient who made a complaint to the federal regulators. Also, from time to time, the government would mine its data and determine whether or not there was a significant number of denials of claims being paid. In the last couple of years, since 2007, DOJ has shifted its focus and instead has really ramped up affirmative civil and criminal enforcement priorities. So they are actively data mining, they are actively running statistics, they have third-party contractors going out and conducting surveys on site to try and determine at the facility what's really going on. And they're also increasing their use of wiretaps and Title III.
Yeah, we were talking about this before in the green room. There's this shift where we're seeing more coordination between criminal and civil actions. Why now? Why is that happening? Is it just more feasible to do so, or is something else driving that trend?
Money, to be short, but also it is more feasible to do so because they're finally realizing that with coordinated efforts, they've just got that many more resources at their fingertips. So on the civil side, you've got strong coordination from a fiscal intermediary standpoint. So the fiscal intermediaries are the contractors who are recovering claims and data mining and determining whether or not those denials and adjustments need to be made and whether they need to seek recompense. And so the civil side's always been focused on the money. The criminal side, on the other hand, has the ability to seek wiretaps, has the ability to convert witnesses, grand jury subpoena authority. And if you think about it, operating in a vacuum doesn't really make sense. But when you bring the two together, you've got the money as well as the investigative resources, and that's where you get billions of dollars in recovery in healthcare fraud.
Is it presumptuous to say that this coordinated approach is yielding positive results for the government?
Yes, Eric Holder has said recently that healthcare fraud prosecutions are up 75% since 2007. This year alone, healthcare fraud prosecutions netted $2.3 billion for the United States, so it's certainly worth their investment.
So are we going to see more prosecutions in 2015? Eric Holder is going to be stepping down. What comes next?
You will definitely see more prosecutions, in part because False Claims Act cases have an incubation period, if you will. When somebody comes forward as a whistleblower, the government has an opportunity to investigate that, and so it takes a little bit of time for those cases to come to light. In addition, the longer term, more aggressive healthcare fraud prosecutions require coordination of witnesses and determining data, and they're fraud cases, right? So it takes a long time to do those investigations. So sometimes the results they take some time to develop. With Eric Holder stepping down, there's no reason to see any change because it is such a cash cow for the government.
Let's blow this out to 35,000 feet. Are there any legislative or regulatory changes coming on the horizon that's going to make an impact on the playing field as it stands today?
Yes, the Affordable Care Act and its implementation and the regulations that are becoming final as we go forward are going to continue to have an impact. In addition, the Sunshine Act regulations are going to be final at some point, hopefully soon, and that then places a burden on healthcare providers to come forward and affirmatively disclose information they had never been required to disclose before. In addition, the 60-day refund rule is something that the government is now pursuing civil and criminal actions on where they hadn't done that before.
Yeah, well, it's an interesting time to be talking about this stuff because, like you said, the government sees a lot of money at stake here. This is an awfully big business that touches pretty much every aspect of the American economy and the global economy, for that matter. What do you tell your clients going into the new year?
We're telling our clients to continue to be vigilant and continue to follow their compliance programs, follow the regulations, make sure that they're dotting their I's and crossing their T's. Because if they're not, that is one factor that DOJ looks to when it determines whether to criminally pursue healthcare providers. It's one thing to have a compliance program on paper. It's another thing entirely to follow it, to be vigilant about it, and to make sure that your C-level employees and the folks on the board of directors, your managers, your vice presidents are all believing in it and adopting it and making sure that it's followed on a day-to-day basis.
It's all about keeping your house in order.
Absolutely, and really doing it, not just saying that we're doing it from a prophylactic standpoint.
Lisa, thank you so much for your time. Bye.
You're very welcome.
That's Lisa Noller, partner at Foley and Lardner. If you'd like to see more of the stuff they're working on, go check them out at Foley.com. You can also find them on LinkedIn, YouTube, and Twitter. I'm Pacchia. Thanks for watching.